A series of webinars hosted by the Dalla School of Public Health. Today we're really fortunate. We're going to we've been looking at various different dimensions of the pandemic and basically the broad societal response to the pandemic. And one of the key elements that's helped us sort things out is, of course, the world of journalism. And so today's panel is called Journalism, a Public Health Tool in a Pandemic. And we are really fortunate to be delighted to be joined by four experts in this area. So the format of today's panel is going to be, we're going to have four speakers. They've been each been given a question. I'll introduce them very shortly. The format will be they will take their time to answer the question, then we'll open up for a little crosstalk amongst them. And then, of course, we will be taking questions from the audience. The unique feature of today's webinar is that we are actually hosting a Twitter chat tomorrow at noon, and you can register for that Twitter chat by going through the same mechanism that you use to register for today's webinar. So without further ado, I'll also remind you that there's a hashtag for this, which is hashtag COVID-19 DLSPH. So please feel free to tweet as this is going along. It's going to be published, the Zoom will be published, webinar will be published tomorrow. We ask everybody on the panel just to sort of put their microphones on mute for the time being. So I'm your moderator and host. My name is Ross Upshur. I'm the professor at the Dalla School of Public Health and the division head in clinical public health. And today we're joined by Rob Steiner, who's the director of the Dalla Fellowship in Global Journalism at the Dalla School of Public Health. Robert Cribb, who's an investigative reporter at the Toronto Star. And then two graduates of and past fellows of the Global Journalism Program that Rob Steiner has run. Akila Wise, who's a public health scientist and journalist based in Atlanta, and Tabassum Durrani, who's a lawyer and journalist based in Toronto. And as mentioned before, we'd like to highlight our graduates and alumni of our program. So we're particularly delighted to have Akila and Tabassum with us today. So I'm going to start with Rob. Rob, what should we have learned from SARS about public health communications during outbreaks? And do you see much evidence that we've learned from this?
So, everyone famously knows about the Naylor report, and I'm going to get to that in a moment. But there were a couple of interesting, when I was reviewing the literature on this, I came across an interesting, somewhat more obscure literature that speaks really to the health stakes in communication. So shortly after SARS, that was 2003, there were two research teams that came to Toronto to study the psychological impact of quarantine. So to be clear, SARS was very different than what we're facing now. There were only 273 probable cases, only 44 deaths. There were only 30 mandatory quarantine orders, although apparently 30,000 people roughly quarantined themselves voluntarily. And quarantine was very different than social isolation. I mean, you were really cut off, you were stigmatized to some degree. Because the whole population wasn't going through it. But these two teams that were here, one was a team from U of T, and another was a team actually from the US military that wanted to understand how quarantine works on a population. They found that quarantine was actually associated with an elevated risk of persistent PTSD, post-traumatic stress disorder, with the comorbidity of depression. Under circumstances that with people who would not otherwise have experienced them. So it's pretty directly linked to their experience of quarantine. Some of the factors are unrelated to the stuff we're experiencing now. Isolation, stigmatization, we're much more connected. Today we're less stigmatized for having to be socially isolated. But the one that actually they really drew attention to was bad communications. Communications at that point were they were uncertain, they were inconsistent. Some was from politicians, some was from public health people. Some folks weren't getting communications at all. And in fact, when the US military team pulled people in Toronto who'd been in quarantine, asked them, where would you like to get your communications from were this to ever happen again? 70% roughly, but 66% said from a public health person, not from a politician, right? And so the health stakes, although our conditions are very different than they were back then, it's easy to imagine that, not only are we experiencing some mental health stresses now and the associated physiological health stresses that go with that, but that communications actually will play a role in how quickly we rebound and what the longer term mental health effects out of this experience are. So the stakes from a health perspective are high. So now let's shift actually to Naylor and what we learned with Naylor. So David Naylor, who at the time was the Dean of Medicine at U of T, subsequently became the president of the university, was commissioned by the federal government in 2004, basically to look at, or 2003 actually, to look at everything we could learn out of SARS. I at the time, had left my journalism work and was actually a senior political advisor to Paul Martin, who at the time was about to become prime minister. And I was advising him on healthcare and public health. So I got to know David through this. And on the communications side, this wasn't, the bulk of the report was about other things, but on the communications side, this is what he said. He said, the SARS outbreak underscores the need for public health to play a leadership role in analyzing risks and communicating effectively about them. And he went on, he said, the credibility of that messaging is enhanced by its distance from the usual machinery of government. The CDC actually built on that and now has a protocol at the CDC. It's ironic because the CDC has been completely absent in communications in the States. But formally speaking, they actually have a protocol to address exactly this. And they say that in outbreak, communities should designate one spokesperson who's characterized by their familiarity with the issues, with the frequency of their appearance, and their confidence in being able to address the nuance, right? And to that, I would add empathy. It's important to know that in Canada, we did not learn this lesson initially, right? So our first few weeks of this outbreak were disastrous. I would say disastrous is too strong a word, but we were hearing mostly from cabinet ministers and mayors and premiers, and not from public health people, with the exception of British Columbia, I would say. And the question then came up as I was sort of musing on this with colleagues, and sort of researching this a little bit, the question then came up, well, if you have a good brief, what's the difference, right? If the premier can come out and he's been briefed well by the public health folks, what's the difference? And here's the key thing. In any health situation, and in particularly this health situation, it is so important for a leader to be able to say bluntly to the public, we don't know. Politicians, and I've worked with senior politicians, have a real problem with saying we don't know for understandable reasons. When a politician says we don't know, the public hears that as you're either hiding something or you're ignorant. But and that's largely because the politician can't elaborate, can't do what the clinician does. When a scientist or a clinician who's relevant to this field says, we don't know, she can then go on and say, we don't know, and I'm actually not so worried that we don't know this particular thing because we can do other things. Or we don't know, and it's important for us to know, so we're actually going to figure this out. Or we don't know, and we're not going to know, but it's important, so we're going to find some surrogate for that data. That's what a public health person can do. And what that does, to bring it back to long-term health effects, is it takes uncertainty and it actually builds an empathetic bond, right? Uncertainty can be alienating and frightening. And I think a lot of scientists say, well, if I can't be certain about what I'm saying, I'm not going to say anything. But mental health professionals also know that uncertainty, if it's elaborated on in the right way, can actually build an empathetic bond with someone if you acknowledge the uncertainty, share the uncertainty, and then explore it, right? So that's why public health professionals need to be at the forefront here, and also need to be able to share and elaborate on their uncertainty. If you want to see some good examples of that, the technical briefing in Ontario from 2 days ago was a really good example of how that's done. Just in the last couple of minutes, I'll go into one other thing, which is that the scientists and the public health professionals can learn actually from the best politicians on one dimension at least, and that's empathy, right? Empathy, we throw the word around. What empathy really means in shorthand, I think, is being able to sit enough in someone else's shoes so that they do not feel alone and overwhelmed. And that, again, the mental health professionals will tell you that actually has a health effect that mitigates stress and mitigates all the other risks that come from elevated persistent levels of stress. So the best politicians around, right? And I would count New York Governor Andrew Cuomo, the New Zealand Prime Minister Jacinda Ardern, to some degree our mayor in Toronto and the Premier of Ontario have been good at this too over time. What empathy means is actually using, here's some hints, right? Using the right kinds of pronouns in our language. A lot of academics and scholars are tempted to speak about the population in the third person. People should do this, people should do that. That's alienating. That puts the onus on me, tells me I'm alone, right? The best politicians who know how to empathize say, we should do this, we're doing this, we have to keep doing this, I'm in this with you. Now, clearly there's a limit when, if I were speaking to a group to which I clearly don't belong, if I were speaking to a group of women or an indigenous population or something, I'm not part of that community, so I have to use, the third person in a very respectful and humble way. But in the Gen Pop, we should be saying we. And there's one other pronoun that's actually worth using. It underscores this, a fast track to empathy, which is you. in a certain sense. So yes, if you look at the technical briefing from 2 days ago in Ontario, Matthew Anderson, who's the CEO of Ontario Health, did a beautiful job with this. At one point he said, thank you. Thank you people for doing what you're doing for isolating and so on, physical distancing. We in the general population have gotten used to thanking essential service workers, health workers, as we should, right? It's also important for the health workers and for the public health leaders to say thank you to us in the general population, because that again builds the bond. Empathy mitigates the risk of long-term health problems coming out of social isolation. And so that, I think, have we learned this from SARS? I would say in Canada in the first 3 weeks, no. I was shocked at how little we'd learned. I think now we're starting to actually really get it. I think in the States, not only did they not learn, I think they're actually getting worse as the discussion about this is getting polarized. I won't say more about that. Aquila is actually in one of the states that is highly polarized on the subject in Georgia. But that's my own sense of what we've learned and what we haven't and what we should be thinking about at this point in the communication side of it.
Great, thank you, Rob. And now we will turn to the other Rob Cribb. Rob, in a crisis, citizens are urged to follow public health leaders without asking too many questions. Is it the right time to hold governments to account? And how, in fact, do you hold governments to account during a crisis? Oh, you need to unmute.
I'm so sorry. Can you hear me?
Yep.
Great. So the short answer is, yeah, obviously that's the role of journalists. And if we're not conducting accountability reporting now, perhaps more than any other time that I can think of in my career in journalism, I think it's probably time to shut off the lights and lock the doors and walk away from it and leave accountability to press releases from the government. It's a fundamental plank of what we do as journalists. It's core to our mission. It's core to the functional operation of a sustainable democracy. And so the short answer is yes, we have to be doing that. There's no question about it. The long answer is everything I just said has been vigorously challenged by a certain segment of politicians and public health people, and certainly a segment of the population who think that, in fact, it's not the right time at all to be asking difficult questions and raising uncomfortable ideas. And it's been fascinating. I've never seen anything quite like it. There's nothing particularly new about criticism aimed at journalists who ask difficult questions. I've never done an investigation where I haven't been accused of being biased or having malice or having or sensationalizing, which is the most common thing you hear. But this is in an altogether different level of scope and depth, I think, than anything I've ever really seen before. And I think it's obviously because, in part, it's hard to think of another event that has mobilized and engaged the entire planet where there's literally one story in the news cycle for such a long period of time. And I've spoken to colleagues about this. If you read the email inboxes of reporters across the country, they're filled with the very same kinds of back channel and public statements from officials and the public. Listen to talk radio shows, listen to punditry on this issue. There is a very strong backlash, I would say, against the kinds of things that we're seeing. And so I've thought a lot about what's going on here, and it's never simple. There's never any one answer, I don't think. But obviously we're in a very unprecedented time, emotionally, or professional lives or personal lives. There's lots going on. And then I do think that there's something to be talked about. Rob just mentioned the use of words and language, I think, because we're both journalists, is very important. And so just think about the public narrative and the framing of this at the press conferences every day. Team Canada, we're in this together. We're going to get through this together. And the repetition of the wartime metaphors, which may or may not be effective public engagement. I suspect it probably is, but it's fascinating to sort of hear that. And then so you have the politicians and the public health people speaking, and then you get to the part every day where the press conference begins, and then reporters start asking questions like, so why did we send 16 tons of PPE equipment to China on the eve of a global pandemic? Why are we not releasing the kind of modeling data that other Western countries have released? Why is it so difficult to access the kind of data metrics that we're seeing in other places? And you see the narrative tension unfolding in those events, those daily events. And of course, it's unfolding hundreds and thousands of times a day elsewhere in interviews and press conferences across the country. And many people find these questions impertinent and in some cases traitorous. And you're certainly sort of starting to hear that in social media and in the talk shows where there's this kind of COVID McCarthyism emerging. And it's fascinating to watch. And if you look more broadly to countries where there's less protections for free speech and journalism, there's some really chilling things. In Hungary, the government threatened independent journalists critical of the government with 5-year jail terms for spreading misinformation around COVID. Thailand and the Philippines, similar moves. Yemen, this is all reporting from various sources. The Committee to Protect Journalists reported Yemen, Jordan, and Morocco have banned newspaper printing and distribution under the guise of not wanting to spread COVID. Egypt's removed the Guardian correspondent. China's removed a number of US journalists. And, just look south of the border, the withering daily attacks, even more aggressive than ever from the President of the United States against reporters who are asking questions about legitimate questions by any measure about the preparedness and control measures of the spread of the United States. And so all of it plays into a real divide, and it's puzzling to me, frankly, from a journalistic perspective, but it's very real. Cuomo, who Rob just mentioned, said something the other day. I was watching it on CNN. It was striking to me. He said he was asked about the incredible death toll in his state and the mechanisms in place which allowed it. And he said the time, and I'm quoting here, the time to deal with these issues is after the war is over. Which is wrong. It's just objectively, from my perspective, wrong. We see it, we all know the old adage, the truth is the first casualty of war. When we look back at Afghanistan to Iraq to World War II, there's real lessons in what happens when journalists are not asking enough tough questions. And so there is this emerging tension. It seems actually to be growing more than not. It's not in any way unanimous. There's sources coming forward to people like me and my colleagues every day, senior level government officials and public health officials who are coming forward with information they feel is very important and needs to be aired out in the public realm and investigated properly. I got an email from one of them yesterday, a very senior medical official in the city, not a particular fan of the Toronto Star in any way because of our past reporting on doctor disciplinary transparency and OHIP billing, but nevertheless sees value in the kind of long-term work that we do around research and the sort of wide swath of work that we do particularly on our investigative work. And it's extraordinary tip. And if it bears out and we're able to verify, it will be a matter of significant and high public interest. There's no question about that. But it needs to be understood that it will be reported through independent inquiry that synthesizes a vast array of information that we're going to slog through and try and get access to at a time of unprecedented restraint economically. We have a freedom of information system that is ground to a halt. So many of the mechanisms that we traditionally use to get access to information have all but ceased entirely. And it will be done independently, and that's the value of what we do. The idea that journalists should join the team and cheerlead the players to victory is short-sighted. I think it's dangerous. If critics who believe that's the role got what they wished for in the lapdog press, I think journalists become stenographers and they'd be unhappy with the results that they're getting. And all of this, of course, is unfolding at a time when newsrooms are shrinking beyond recognition. They're a shadow of what they once were. My own newsroom is laying off 85 people in the midst of since COVID, essentially because whatever advertising revenues did exist are entirely shut down now. So there's real strain putting together complex information on a daily basis with a withering pace, sitting in dining rooms and bedrooms and living rooms, somehow getting this all together to release every day it puts added strain on all of this. But philosophically, the bottom line is, if we're not doing this, then what is the point? So the short answer, I would say, is we have to do it. It's more challenging on this one than it typically is, and it's always challenging for sure. But this is certainly a different level of adversarialism, I would say, than anything I've encountered in the past.
Thank you, Rob. That was brilliant, and you've given me a new term for my lexicon, COVID McCarthyism, which I will, with your permission, borrow and steal. So now we'll turn to Akila Wise. Akila, from your experience as both a public health scientist and now as a public health journalist, how can journalism influence policy that public health agencies are developing to address COVID-19 in racialized and marginalized communities? In other words, how do you think journalism actually can affect public health policy?
Yes, thank you for that, Ross. So, as a public health researcher and scientist and now journalist, I've been concerned with the ways in which how society is structured affects the health of marginalized populations, primarily how social and structural determinants of disparities end up marginalizing people as well as their health. And so given that, being concerned with issues of racism, gender inequalities, poverty, educational systems, and environmental racism, I think it's important that we're able to showcase the stories of marginalized populations, because those are where the solutions are, and those best practices. And doing my work, I'm always concerned with the relationship, historical and contemporary, between marginalized populations and media. There's been issues of misinformation, of mistrust, and also of missing the narrative when it comes to that. So I'm always aware of that when I talk to people and the sort of stories that I do. And to me, I think it's most important that we change the narrative, or try to influence the narrative, when it comes to health disparities and underlying inequities that are giving rise to what we see right now with the racial disparities in COVID-19, and how Black populations are disproportionately bearing the brunt of that sort of this disease. And so currently, I've been, in my work, connecting with researchers, connecting with advocates, people who work with marginalized populations, people who are from marginalized populations, who are doing the kind of work that I think speaks to the connection between public health and the public, weaving their various works and insights to create a story that will engage a wider audience, including the public, but also those who are in power, policymakers, and being able to showcase public health, which a lot of it is about data, information, intervention, surveillance, programs, weaving those elements together along with stories of people who are on the ground, to do the sort of storytelling that it takes to reach a wider audience when it comes to public health, and hopefully enacting change that will help mitigate disparities and other inequities. With COVID, there's been challenges in reporting from home and getting in touch with populations who are may not be featured in our mainstream publications and mainstream dialogue in the media. So I'm just curious about the people who are in my own life, given my background, where I've grown up and where I've been. I'm a part of communities that are historically marginalized. And I'm very privy to the way in which the world works, affects the health, but in addition to having that public health background, also knowing the research, the evidence. And so I think when it comes to public health and journalism, there's a really nice tandem in which we can be able to talk about the stories that are being missed. Marginalized people create marginalized stories. So it's even more important now with this new cycle of COVID, where we are fixated on one thing, as Rob Cribb mentioned, and the news cycle is so quick, and it's been so much that many of those stories may not be showcased just because of the sheer volume of the news. And so in the work that I'm doing, I'm still trying to connect with people who are the experts, who do the work on marginalized populations, but also creating that story, finding the people whose stories reflect what's really going on in the broader experience of populations. And so that's still a work in progress for me, even, moving from the experts to the data, to the people and their lived experiences. So, since COVID has settled into the US, I've published or released 3 stories around that. And I mention these stories because it just goes to show that a lot of the work that we're doing has just been continuing the work that we've been building up for the past year as a journalist, in speaking about other fellows. For me, I was able to release a story on abortion providers here in Atlanta. The issue of abortion and reproductive justice has been here in the South for years. And just because of COVID doesn't mean those issues go away. In fact, much of my work has been looking at the intersection of a pandemic like COVID-19 and other issues going on. So with abortion, I was able to talk to people who I was already in contact with. One of them being the director of the Feminist Women's Health Center here in Atlanta, a longstanding abortion care advocate and reproductive justice advocate here in Atlanta for women in the South, and giving a chance to showcase the story of what people are doing to still maintain abortion access in Georgia, despite all that's going on around the pandemic. Another story I was able to break was how the pandemic intersects with the current surge in sexually transmitted infections here in the US, taking a look specifically at Texas and how they have the highest rate of congenital syphilis, syphilis passed from mother to baby in utero, and how that intersects with COVID-19. Still being in touch with many of the physicians and doctors that I made relationships with late last year, working on these stories. Once COVID pandemic was really, becoming a thing, I went back to those people and asked them, like, how is this intersecting with the work that you've been fighting so long to do, and how is this intersecting with the rate of congenital syphilis? Most recently, actually just today, I published a story on just the importance of self-care in the face of a pandemic, and thinking about the mental health aspect, right? And what does public health have to say about how do we mitigate our own stress and our own anxiety, given that our healthcare systems are tapped? Many of us are at home, and this is an unprecedented event in which many people are going to be experiencing psychological distress, mental anxiety, and particularly thinking about our healthcare workers. What can we learn, again, from past epidemics? SARS 2003 comes to mind. What do we know from that as far as psychological outcomes, psychological distress? And what do we know now as far as self-care, mitigating stressors, and the importance of mitigating stressors for our own immune system? That story, again, was based on conversations, based on networks of people who are, again, doing the sort of work that I think is important, that I think speaks to the public, and that I think the public should know. A lot of my work, and that's really just the tip of the iceberg, because again, with this sort of news cycle, we're not able, especially as freelancers, to get all of the stories out there that we want to do. So, those 3 stories were published, but I've also been listening to stories from sex workers. Before COVID-19 hit, I was talking to people who are patient advocates. So people who are trained to help those who are more vulnerable in the healthcare system to navigate that healthcare system and to navigate issues of stigma and misinformation and things like that. I've been talking to people who work in mental health, people who work with those who have HIV. And again, just a really keen interest on researchers who can offer sound and informed explanations for the health data that we're seeing. And again, not being afraid of saying, I don't know, but this is what we do know. And this is what public health has to offer for the public and for people at large. Right now, I'm working on a study to help sort of change the narrative around health disparities in COVID-19. this is from my own training as a public health researcher, in which, sometimes, you talk to people to get the literature and the updates, but also you just rely on your own background and your own teaching of what you've learned in public health. And so just knowing the canon of public health, knowing that people are going to not deal with COVID-19 because there are inequities in place in ways that are going to protect their health. So in thinking about racial disparities in COVID-19, I've been thinking about what many health disparities experts know to be a fundamental cause of disparities, and that's residential segregation, and how decades of formal and informal practices that steered Black people into disadvantaged neighborhoods, into under-resourced neighborhoods, is now playing a part in the racial disparities that we see, at least here in the United States. So again, interviewing various public health experts. Public health experts are also very good for being tied to community-based organizations. I don't want to leave those people out as well, because they have been also very, very instrumental in these stories. And the work that they do is also very important. And so again, it's about influencing and changing that narrative in hopes that, the more of us who are out here talking about the untold stories, the untold narratives, but also what does public health have to say about those narratives. Many times public health research, I've found, has been quite validating of marginalized populations, especially if they're coming from health disparities researchers who know that history of marginalization and how that affects health today. And so it's important that publications, that editors, that we know who are the experts who are doing this kind of good research around marginalized populations, who are telling those untold stories through their research. And those of us who are acting as a go-between between the public and researchers and advocates and other people who are doing this sort of work. Another good place that I found public health and journalism intersects is solutions journalism. So, as public health researchers, we're so good at naming the problem, describing the problem, studying it, giving the data. But there's also really good experts and people who are doing work around solving those problems, interventions, and solutions and strategies. Public health experts are also very good at thinking about strategies. And in most peer-reviewed articles you see around health disparities, there's always recommendations for the sort of problems that we see. And I think that, these strategies can influence the way in which we think about things in the future as we pull ourselves out of, this pandemic, and we think about ways in which we can build a society that protects public health moving forward. And a lot of that has to do with paying attention to stories of marginalized people who have borne the brunt of oppression and who are now dealing with, ways to survive during this pandemic with as little resources as possible. And how can we mitigate that? With the story I wrote with COVID and abortion, one of the important things that came out of that was the importance of telemedicine and how telemedicine can cut cost for women who are low income, women who don't have this sort of in-person access to abortion, particularly those in the South. Other things that we think about when we're doing these sort of stories and thinking about policy influence, program influence, common themes in these stories from marginalized populations, particularly here for the US, the importance of universal health care, but also equitable health care, getting rid of bias, training for people to be aware and to just not practice discriminatory medicine and health care, and well-funded equitable educational systems, well-funded mental health systems, paying people living wages, sick leave, childcare leave. All of these things are coming up now. And there are things that public health researchers, especially those who study disparities, have been talking about for a very long time. And so,
Akila?
Yes.
Hey, sorry to break in, but we need, maybe we can come back to some of these in the discussion period, but because I want Tabassum to have a chance to speak. Great insights, really appreciate it. And I feel that, bringing so much depth and breadth of your experience to this, and we will come back to it. I'm sure there's questioners in the audience that would like to hear more insights from you. So Tabassum, last but not least, thank you for your patience and waiting. We've had really excellent presentations thus far. So as both a lawyer and a journalist, you work very closely with some of Ontario's poorest communities and with communities of new immigrants. Is our current approach to pandemic communications effective for poorer and new immigrant communities in Ontario? And could they be improved?
Well, I think what we're seeing is that COVID is really amplifying existing issues and challenges that people, journalists, lawyers, health practitioners have existed for a long time. Challenges that people on the margins of society face every day. We're also seeing, I think, the limits of our income security framework, I guess, nationally and provincially. And so I think, similar to what Akila raised, we're really talking about people that have been advocating for things like paid sick time, a more robust income security system, better supports for newcomers, better options and supports for people that are precariously housed. So this is just really amplifying existing issues that have certainly been around in communities for a long time, certainly that predated COVID. From my perspective, at the start of this pandemic, the messaging, at least that I was hearing and sources that I've talked to were hearing, was certainly well-intentioned and I think very practical. Things like, you may have to stock up on food supplies, on medications, in case you have to stay home for 2 weeks. And that resonated with certain people, particularly people that had the resources to comply with that. That is not the case for many people in our province and in our country, quite frankly. At the start of this, I wrote a story about that and talked to people in various communities about what they were doing to prepare for the possibility of having everything shut down. And it was quite extraordinary to hear people say, even talking to people on welfare or disability about stocking up for 2 weeks was a really impossible feat. And, the option of staying home when you're sick, that seems, entirely reasonable and certainly from a public health perspective is important. If you're precariously employed and you don't have paid sick leave through your work, that is not such a clear choice, unfortunately. So certainly in the reporting that I've done and throughout the course of the program, but especially in the last month, those are really the challenges that I'm hearing, and the need for messaging and policy to be looked at through the lens of vulnerable people, how they experience the impact of this pandemic and the choices that they have to make. And those choices are distinct from the choices that middle to high earning Ontarians and Canadians have to make. I spoke to an ODSP, an Ontario Disability Support Program recipient, earlier this week, who described, in really stark terms, the choices that she has to make on a daily basis. Namely, if I run out of money mid-month, I have to go take public transit to go to a food bank to get food. That means waiting in line with other people. That means going on the subway. Now, ordinarily that was her life before COVID, but now that takes on a fresh urgency and exposes her to the exact risks that, the rest of us are trying to avoid. So these choices have to be part of the discussion when public health officials are strategizing what they're going to communicate to the public and also the people that are making policies with respect to income security, with respect to how we respond to this issue. Another aspect of this, and it's something that's come out of reporting I'm doing now, is how low-income people in our province try to access supports that are available to them. We know that the federal government has announced emergency supports for people that may have lost their jobs, and there are still issues with navigating that. But if you're somebody that lives on welfare in Ontario or on Ontario disability, you are really concerned, or you're concerned about whether you qualify for those benefits, if you can access some additional financial support. So how do those benefits, how do those policies interact? And what's becoming clear is that some of the messaging around that hasn't been as clear as it could be. I'm hearing from people on disability that there are discretionary benefits available to them, but they have to call their caseworker to get it. It's not something that the ministry has made as public as perhaps it could be. And it's something that requires people to do, to take a step that might be difficult for them to do. If you're living, if you're living on a tight income right now, you may not have access to internet. You may not be able to make the calls or send the emails that you need to get support. So again, it's another example of how policymakers, while well-intentioned and are trying to do and institute policies, aren't necessarily communicating them to the people that need to hear it. And I've heard that from a few people this week, that, I can't get a hold of my caseworker. I don't know where I'm supposed to go when I have a question or an issue about my entitlements to things. So I think that's a challenge. And I've read similar stories across Canada about how policies aimed at marginalized and vulnerable groups aren't being communicated to them properly. So in Manitoba, there was the provincial government announced that people, undocumented workers, would still be able to access healthcare in the context of this pandemic. Yet agencies that worked with that population didn't know about that, and people were still coming into these centers, legal clinics, or not coming in, I should say, calling, asking questions, and were really scared about what they were going to do and how they were going to navigate a situation if they got sick. I want to jump on what Rob Steiner said at the start, the idea that messaging or trying to communicate empathy. A common thread through all the interviews that I've done thus far, whether it's with people on welfare, advocates for immigration detainees, I've been struck by just how much worry and stress and fear there is for people. That exists in normal circumstances. But now it's taken on a degree where, people are scared that they're going to be homeless in the context of a public health crisis. So I think that when we talk about messaging, when we talk about the role of public health communications or or the role of journalism broadly, I think it is really about telling those stories and amplifying that message, because oftentimes I think those groups of people do not feel heard. I wrote a story a few weeks ago for a publication called Healthy Debate about some of these issues. And up until today, there are hundreds of people that are commenting about their daily situation while living on CPP disability, welfare, EI. And it's quite, it's the descriptions of their fears, of their concerns, of their questions are, for a journalist and for somebody who works in a legal aid clinic, those are stories that I have heard before, but I'm struck by how anxious people feel that they aren't being heard. And as journalists, I think we have a pretty unique role in giving these people a voice, and hopefully at a time when policymakers are really reacting to this pandemic as it unfolds, journalists have a pretty unique role to play in highlighting groups of people who may not necessarily have their issues at the forefront of policymakers, whether that's, again, people that are in immigration detention or migrant workers who in the best of times have work in a very precarious industry, and now are in a lot of cases left wondering, where am I going to be able to see a doctor if I get sick? So these are all questions that have existed prior to this. They've just taken on a fresh urgency today.
Thank you, Taliesin. Wow, what a great set of presentations, and we're really grateful for your insights. We have some absolutely spectacular questions coming in. I am not sure we're going to be able to get to them all today, But fortunately, we have the Twitter chat tomorrow, which is another opportunity for members of the audience to interact with our speakers today. I'm going to ask this question first. So I get a little bit of moderator privilege in sequencing the questions. There's one that's attracted quite a lot of traction on the Q&A, but one that came through on the chat line, and rightly so. You all did not address social media because you were talking about journalism, and journalism is obviously quite distinct from social media. There's been a concern, and we've faced this in many of the committees that I've been working with, about the infodemic. So what kind of strategies do you think we could put in place to manage misinformation that's coming not just through social media, but through legitimate media vehicles? Does anybody want to take a first crack at that?
I can jump in just to
go ahead, Rob.
To get it rolling. I think there are two dimensions to this. There's a government dimension, and then there's the journalists. We were also talking about the whole preprint problem in the scientific literature too. But let me just start with the government. I think one of the things is information loves a vacuum, right? And there's a natural tendency by both politicians and by scientists. On the one hand, it's sort of ironic because there's the opposite tendency as well among some scientists now. But there's a natural tendency among folks to say, if I don't know this for sure, I'm not going to say anything. And I'd rather not say anything than say something that is not certain, right? That is a bad approach under these circumstances because nothing is certain. We don't know this disease well enough for things to be certain. So I think that governments not only should be, I think governments have gotten the message that they need to be out frequently, daily with briefings. It took about 2 weeks, to my surprise, for them to figure that out. But they actually figured it out now. But those briefings have to be meaty. I think that I love, and I'm a bit of an addict for the technical briefings. I don't love the sparring from the politicians. I think having a technical briefing every 2 weeks, I know there's a ton of work that goes into each one of them, that's too long. And it may not be that we have a lot of data every week, but we need to actually have meaty information, I'd say a couple of times a week, even if a big chunk of those briefings is, we don't know this yet, we don't know this yet, we don't know this yet, but I'm going to give you meat. The more rhetoric there is out there in the daily briefing, the more it leaves a vacuum for people to fill with garbage. I'll leave the other thoughts to my colleagues.
Any of the other members of the panel want to chime in here on social media issues? Rob? Okay, yeah.
Yeah, I'll just say that question can apply existentially to journalism and the world and social media and its role and how to combat misinformation of all kinds. It's obviously an intense issue right now, but it is ever thus and a constant challenge. And so, I agree, more information is better, and ultimately bad information in the marketplace of ideas ultimately should get exposed with public scrutiny, et cetera. So, I don't know how to combat that other than sort of from a journalistic point of view, other than to just do good work that distinguishes itself and meets a very high threshold and ultimately will absolutely be subject to the ebb and flow of public discussion. And through that, that's how truth emerges in all our fields. So I just don't, it is a vexing issue and there is no solutions to it. It is part of the open social media landscape, which no one wants to censor or in any way curtail. And so here's what's left. And it's ultimately, we all think we know sources that we trust and we go to those sources, and it's the job of journalists to ensure that our work is on the list of people's list of sources that they trust.
Akila or Tabassum, anything you want to add on the social media side of information management? Nope. Okay, so picking up on that notion of censorship, One of the questions that's gotten the most tractions and thumbs up on the Q&A pages, and I'll read it as follows. I'd be really interested in what literature and experts, the expert panelists say about academic medical centers interfering to prevent their employees from interacting with the media. I run into this a lot with one local institution in particular. Can I shake something in their face that might convince them that this kind of censorship is doing more harm than good? Who wants to tackle that one?
I mean, I've been dealing with this a lot, so I can start off on this.
Okay, go ahead, Rob.
Yeah, this is coming up a lot. I've been contacted by at least 6 places. Not all. This question is specific to what is it? Public. Sorry, I lost the question.
Censorship of institutions telling their scientists not to speak with the media. Yeah,
so I actually was able to do one story on a particular chain of medical clinics after an excruciating process of verification. But there is a very, very clear gag order on medical healthcare professionals in these institutions. It's clear to me as an outsider speaking to them, because there is terror in the voices of these people who are reaching out to me because they feel legitimately a sense of righteous indignation and concern, and deep, they're deeply troubled by things that they're seeing. And these are matters of what I believe are public interest and should be made public, but they are absolutely terrified to use their names. This is where I see a really interesting distinction between Canada and the US on this point. But in Canada, it is very clear the messaging is shut up. Do not in any way engage with the press, no matter how serious the issue. And so the people that have been calling me are incredibly thoughtful. They have gone through all of the proper mechanisms to raise concerns that, and hit brick walls, and ultimately they're reaching out to us because, like, what is in it for them to reach out to a journalist at personal risk? Why would they do such a thing? And they've got the documents. Once we go through the process, they have the documents, and there are memos, and there's things that verify. But I've only been able to get one of those stories into print, and it's a great source of great angst for me because, and that one took a long time because, contrary to perhaps the popular notion that we just get an anonymous tip on the phone and we put it in the newspaper the next day, it is excruciating the level of rigor that we have to go through to get that story. And to use an anonymous source and to double and triple source and get documents that back up what they're saying verbally on, you know what I mean? Like it is, I just don't think people really understand. And the truth is, I've not been able to tell 5 other of those stories because I've not been able to reach that threshold. And these are serious stories that deserve public attention. But because the shroud of secrecy, particularly in the healthcare and the medical community, in Canada is so strong and the risks seem to be so high, it ultimately wins 9 times out of 10. Those stories will never see the light of day. That's the truth, and it does not serve the public interest in the way that I think most Canadians would believe.
Can I add something here? Because I've spent the last 8 years teaching doctors and nurses to do journalism. I would actually say in Canada, nurses are more in the vice on this one than doctors. Doctors in most parts of Canada, with the exception of the territories, are not, generally speaking, public employees. They're independent, particularly at academic centers, so they have some backup, although they get bullied at work about doing this. Nurses are a different matter, right? They're employees. But if there are health administrators and hospital executives and health comms people and hospital comms people on the call right now, I am going to beg, as a colleague, as a patient, and as a citizen, understand that when you muzzle doctors and nurses, we pay a very serious health price. It is dangerous for us. If there's not PPE in the hospital, then don't address that by muzzling a doctor or nurse who's trying to get that word out. Address it actually by having the open conversation. That open conversation will actually help you address it. It'll put pressure on the right people to help you. It'll expose the issue. It'll actually do exactly what you need it to do. Do not muzzle health workers from telling us what's actually going on. On top of everything else, it raises our anxiety, and we can talk about that, but there's a really clear problem. Health workers want to talk because they want to save lives, period. Period. They're not in this to build their careers. They want to talk because they want to save lives. So please help them do that. Okay, that's my little ad.
Great, thanks. Akila or Tabassum, do you want to join in on that? So the next question I'm going to choose actually picks up on some of the topics that Akila introduced. How can those of us who are living the inequities, but also with a background in public health, use journalism as a way to advocate for ourselves in our communities? Where can we start? Can you provide some insight on this? And this is open, directed specifically at Akila, but I think also Tabassum and the other panelists may want to speak to this as well. So Akila, we'll start with you.
Yeah, happy to answer that. Yeah, thank you for that question. You know, where to start, I think depends on where you are. But I think the best thing is to start with the people who you are connected with. So like I said, for me as a public health researcher, I know people who are doing this sort of work that I've been working on for the past 2 years. And these are people who are also from marginalized communities. So touching on, you know, issues of not only racism, but immigrant issues, LGBTQ issues, issues of disability. And knowing who is doing that work, either in your community or wherever you are placed, you can start there. As far as getting in touch to, you know, to put your work out there, you know, that's a lot of lead work because you want to be able to find the right publications. But then there's also a part of journalism that's, you know, if you can do it the right way and be informed, you know, using Medium or other sorts of platforms to do a sort of independent journalism in which you're taking stories from your community and what you know, and also using, you know, evidence and research to validate those lived experiences, using various platforms to talk about key issues that are important to you, that advocate for your community, and again, that influences the narrative about your community and where you come from.
Great. Tabassum, do you want to add to that?
Sure, I'll just add that, you know, from my perspective, a lot of my reporting and a lot of the stories, in fact, that I've written and pitched are rooted in my own professional experience working as a lawyer, doing employment, human rights law, but also working in poverty law. So, you know, depending on your professional background, I mean, it took doing this program for me to realize the wealth of stories and issues that existed in the communities that I worked with and thought that I knew fairly well. And so I think that whether you're whether you have a public health background, a legal background, you know, there's lots of stories to tell. And my experience doing this fellowship, you know, in the midst of a pandemic like this, I mean, there are untold stories still, believe it or not, given the constant coverage of this, that people with a unique background or professional knowledge of something will be able to tell. And so it's really tapping into your networks, but also asking yourself, I mean, you know, in what I'm reading, what I'm, you know, consuming online, are there people that I know that aren't represented in that? You know, just briefly, I wrote a story about people in immigration detention centers here in Ontario, but across Canada. And I think that largely came about because media in general and people started to ask questions. Well, okay, we know that this pandemic is affecting, you know, large swaths of our population. What about prisons? Then what about people in other forms of detention? So it was really just about going down the line of trying to unravel the impacts of something like this. So I think the more you start to examine your networks and your professional communities and your personal communities, journalism, you know, stories will emerge, and you know, taking advantage of a time when people are looking for stories like now allows journalism to be a really perfect vehicle for, you know, talking about issues that really need to be talked about.
Thank you. Wow, I can't believe how quickly time has gone by, and the chat box and the question box is just lighting up. We're probably just really getting started now, when unfortunately we need to quickly come to a close. So I'm gonna actually, it'll be like reach for the top, a short snapper, because I do want to get the most thumbed up question asked, and maybe if you could just give me just like a 2-second answer, and we'll give each panelist an opportunity. So the question reads, I've been surprised at how much general public has has the capacity to understand public health concepts such as flattening the curve. How is this effectively done? Social media, data visualizations, press conferences, interviews. In your opinion, what are the best strategies for the scientists to translate complex scientific concepts for the general public? So a really hard question, and you get 30 seconds each to say something. And we'll start in reverse order from where we went. So we'll start with Tabassum, then Akila, then Rob, and Rob. Tabassum.
How should they communicate? What's the most
Yeah,
effective?
what's a good strategy? One good strategy.
I mean, I'm going to defer to the more senior journalists, but I would imagine just, providing consistent information to reputable journalists and providing them with the information they need to write accurate stories.
Excellent. Akila.
Yeah, I've noted that as well and been impressed. I think good data visuals, people are attracted to visuals, consistent communication about what's needed. And again, having the information, the stories out there by, like Tabassum said, reputable sources.
Great. Rob Cribb?
Yeah, I mean, I think data visualizations and summaries are great. The key thing, I think, really is to knowledge translate, use language that is accessible to a wider generalized audience, and to speak with journalists, obviously reputable journalists that have background in these kinds of things, and really offer a sense of humanity and opinion and beyond the data to really try and bring the story forward that reaches beyond the technical language that you published in your journal in the Lancet and move it forward into the world of the understandable and accessible to the generalized public. And you have really smart journalists available to you who can help with that translation, but it's a different part of the brain, and I think certainly more researchers and scientists are moving in that direction. But it's tremendously helpful if they can adopt that kind of mindset going in.
Thanks. Rob Steiner, this was your idea for the panel. You get the last word.
It's very easy. It's one word, really, but I'll elaborate on it. Of course, trust. Right? You're asking us to trust you. We have to trust you. And I'm speaking now to, the health leaders, health scientists, public health leaders, and so on. Trust us. As a general population, as journalists, trust us to understand, trust us to take it seriously, trust us with slides and data and give us a ton of that stuff, and trust us with empathy, right? So trust us, because it's a trusting relationship both ways. That mitigates all the risks that we're talking about.
Great, thank you. Well, what a wonderful panel. I'd like to thank Tabassum, Akila, and the two Robs for absolutely stellar presentations, and thank the audience as well for their excellent questions. We didn't get to them all, but we have a method for getting responses. And the other thing is, thanks to you for showing up and for your interest. So I'm going to bring this to a close now. I wish you and your families and your loved ones and everybody in your networks, I hope you're well, you're safe, keep well, keep sane, in solidarity, maintain social distancing. We now have, where I live, 3 Canada geese apart, however many of each need to be. So thank you very much. Appreciate your attendance, and we'll see you with our next one. And remember the Twitter chat tomorrow at noon. Thank you.